For the nursing theory presentation, I chose information processing theory. My name is Ashley Miller, and I'm a student at the School of Nursing at East Texas A&M University for the class of Theoretical Foundations in Nursing by Dr. Angela Jarrell as my instructor, and today is November 7th, 2025. What is the information processing theory? The theory is how the patient or nurse takes in, stores, and receives information. Looking at the meta-paradigm of the theory, the human aspect is the focus on the person and how one receives, processes, and responds to the information given. How do the patients perceive their illness? With the environmental aspect, as an indirect implication of the theory, is an external stimuli that affects the information processing as well as the safety of the patients. Health, another indirect implication, is generalized understanding affecting self-care, mental health, and adjusting to the information given related to conditions. As regards to nursing, how do we as an advanced nurse practice process the information given by patients, family members, and the diagnostics to make the best clinical decisions to provide ultimate care. According to Butts and Rich, there are 5 main concepts to the information processing theory. The first is the attention stage. Is there any interest in the topic to learn? If yes, then learning will occur. However, if there's no interest, minimal learning will occur. Are there any distractions preventing the patient from learning to occur? Like a noisy room, the TV's on, they're tired, they don't feel well, too much is on their mind? Reduce the distractions to allow the attention stage to start the learning process. Second is the sensory memory stage, where information is obtained and processed through our senses. Are they visual learners or auditory, or do they need to touch something or hold something to remember? The third stage is the short-term stage, or short-term memory, where transferring sensory memory to short-term. The form in which sensory information is transferred is called encoding. Information only lasts seconds in this phase to help reduce cognitive load, allowing the next stage to occur. But remember, keep it simple to allow retention of the information. The fourth stage is long-term memory stage, which is how the knowledge is stored. How is it stored depends on the learner and the strategies that were used while learning. And lastly, the stage is the information retrieval stage, where the information needs to be used and applied. However, our older adult populations and those with cognitive brain injuries tend to struggle with the retrieval stage. Here are the types of memory in a picture form for all of our visual learners. Why is the information processing theory important in society? In general, we learn on a daily basis and often think of our brain as a computer. Cognitive psychologists use the computer as a metaphor in relation to the brain. A computer codes the information, stores the information, and then later retrieves the information. How does the brain code, store, or comprehend and retrieve the information given? Remembering the 5 stages of processing and learning, which was attention, sensory, short-term, long-term, and retrieval. In a technologically advancing world, we use computers daily and often don't realize the computer in our brain that continues to allow us to code, store, and retrieve information that we use, whether socially, professionally, or even spiritually. How do we interpret some basic everyday information, like daily chores, activities, instructions, or medical advice of a new diagnosis? Processing information is vital to everyday activities. What is a grand theory versus a middle range theory? According to Butts and Rich, a grand theory is a broad theory, too big to narrow down the relationship between a hypothesis to a specific nursing action. An example is Paris' theory of human beings. In the middle range theory, which is a narrow scope view that is supported by empirical data which can be tested. An example of this is a theory of human caring. Information processing theory is neither a traditional grand nor middle range theory, but a psychology theory. Psychology is a scientific study of the mental process and behaviors, which a research-based approach to understanding human behavior. Educational psychology is an area specific to studying learning, teaching, and assessments. Because a theory is a psychological theory, empirical indicators are not present. Information processing theory and my PCOT question. My PCOT question that I developed earlier in the semester was, in elderly patients with urinary incontinence, do physiotherapy techniques compared to pharmacological therapies reduce the frequency of incontinent episodes and improve quality of life in a 3-month period? According to Butts and Rich, the information processing theory is useful when teaching about self-care, precautions about medications, and behaviors to promote health and healing. Regarding my PCOT question, depends on the patient. Are they able to process the information to be able to care for themselves? As a nurse practitioner, did we catch their attention to start the learning process, or were they distracted? Did the patient eventually understand the information given to be able to retrieve the information with a return demonstration of either a physiotherapy technique or pharmacological therapy? Is education or skilled training required before the use of theory in the nursing practice, education, or research? Education is understanding the 5 concepts of theory, allowing all steps to be achieved for complete learning and retrieval of information learned. Skills needed before using the theory, like critical thinking, which would be able to analyze cognitive processing to develop a solution, and analytical skills in assessing how information is processed and retained to create interventions when needed. Has information processing been applied to the real-world nursing practice, education, and research? In nursing practice, the theory has been useful in clinical decision-making, further development of theories, and improvement of nursing education for best practice. In education, creating effective ways to make learning materials, and creating effective teaching models, and in research, observing changes in the information process over generations. Strengths and weaknesses in nursing practice. Some strengths allow nurses to receive, interpret, and make an evidence-based decision in patient care. The sensory and retrieval aspect of memory allows us to remember skills like performing CPR, inserting peripheral lines, and many more skills that we attain from our long-term memory. Some weaknesses are often keeping information too simple or linear to learn from. When educating our patients, are we giving too much information at one time, or are distractions present inhibiting understanding for the patient or even allowing the practitioner to make the best decision? Lastly, when thinking of the computer analog or metaphor, do we mimic something without emotion or even social differences affecting the information being taught? Keeping both the strengths and weaknesses in mind when applying this theory as a nurse practitioner to promote safe and effective practice. Strengths and weaknesses in education. A strength in education would be able to organize information and make it meaningful to remember what was taught. Some weaknesses are time, allowing enough time to prevent cognitive overload. However, if time is not allowed, the information may not be remembered, nor able to be retrieved. External environments also bring a weakness to learning, like past experiences or distractions preventing learning to occur properly. And lastly, a weakness of negative and positive feedback to learning. With negative experiences or feedback, less learning has occurred, where with positive feedback, more learning has occurred. The ultimate goal in information processing and education is gaining attention through an organized presentation and prevention of cognitive load to allow retention of the information taught. Strengths and weaknesses in research. Some strengths are how learners become aware of what and how they have learned, as well as can specifically test cognition, memory, and attention. However, there are some weaknesses, like mentioned before in the social and emotional aspect of learning. Research may be carried out in isolation from other cognitive and motivational factors affecting the overall results in a research. Is it generally feasible to implement practice derived from this theory? Yes, the information processing theory is pivotal to implement in practice. If our patients don't successfully transition through the 5 stages of information processing, it will be very difficult to grasp not only health conditions present, but also the importance of how to treat, prevent, and promote further health issues. We live in a world full of distractions, like phone, people talking, TVs. How do we as a practitioner minimize the distractions to gain their attention to help our patients understand not only the concept of their health issues, but also how to be proactive in their own health? By assuring the information processing steps are completed in the learning process, preventing cognitive overload for the maximum retention of knowledge. Does the practitioner have legal ability to implement and measure the effectiveness of theory-based nursing actions? Yes. As a practitioner, implementing and measuring effectiveness of how information is processed to ensure the proper assessment, diagnosis, treatment, and evaluation is completed for the patient. The Nurse Practice Act, which is ran by each state nursing board to give authority to regulate the practice of nursing care and the power to enforce laws, which protects our license. Are theory-based nursing actions compatible with expectations for nursing practice, and do they lead to favorable outcomes? The theory-based actions are compatible with expectations of learning and processing information to make the best decision for the patients. Guides practices through daily tasks, care provided, and engagement in leadership. It supports evidence-based practice with reason behind the actions performed, and critical assessments in assessing our current practice and how to continue to make it better. Application of theory-based nursing actions in comparison to outcomes. With processing theory, clinical decisions occur in 2 steps. The first, pattern of recognition. In pattern recognition, long-term memory is activated by a cue that form assumptions. Cues tend to come from the past experiences or knowledge. And the second step is deliberate thinking, which is an analytical and rationale of knowledge, which is searching for more information to support decisions. In contrast, without using the processing theory, it inhibits effective decision making without pattern recognition and deliberate thinking, preventing a thorough clinical decision to be made. Would also inhibit the ability for patients to use the traditional 5 steps of processing and lack a successful education and self-care to promote their own health. Benefits and conclusion to theory. The information processing theory allows advanced practice nurse to use the framework to understand how the human brain works, how we can be heard as educators to make a lasting impact on our patients. The theory also allows advanced practice nurse to educate on self-care, health promotion by the patients, and self-medication administration. The theory allows the advanced nurse practitioner to evaluate own practice and find creative ways to make their practice better. The 5 stages of information processing are congruent throughout the entire theory. Our brain, to be the computer, it must go through each stage to code, store, and retrieve information daily. I challenge you this. Evaluate how each stage occurs in your life and learning. Are you attentive? What senses are you using to start retaining information to be stored in your short-term memory? Has it been encoded to transfer into long-term memory? And what does it take to be retrieved from your brain? Thank you for listening to my presentation. The next slide is the references, and I hope y'all have a great rest of your day.